Rhys Jones.
Thank you, Mr. Speaker. Does my friend agree with me that it is high time that the outstanding care and skill of the staff at Hillingdon Hospital were matched by commensurate outstanding facilities, and therefore it is great news that Hillingdon is one of the 40 new hospitals that the government is building by 2030? And can he confirm that the full funding package will be announced soon so that the whole project can proceed as soon as possible?
Well, I thank my right honourable friend for his question. I know the Secretary of State visited Hillingdon Hospital over the summer. It's a hospital I am also aware of, Mr. Speaker. There has been no greater champion of Hillingdon Hospital, but more broadly of the new hospitals programme than my right honourable friend. Mr. Speaker, currently 5 hospital schemes are in construction, 2 are now completed, and we aim to announce the next 8 by the end of this year.
Sarah Champion.
Thank you, Mr. Speaker. 2 weeks ago, a 5-year-old constituent of mine, Yusuf Nazir, died because we no longer have intensive paediatric beds in Rotherham. September saw a record.
I'd be very happy to meet with the lady to discuss the challenges in her own trust.
Shadow Minister Dr Alan Khan.
Thank you very much, Mr. Speaker. The current state of mental health treatment sees increasing numbers of people languishing on waiting lists, becoming more and more unwell. 1.1 million adults denied treatment. Children stuck in emergency departments for days waiting for mental health beds. Is the government proud that the systemic cutting of a quarter of NHS mental health beds over the last 12 years has led to more patients receiving treatment in private settings? And does the Secretary of State know how much money is given to private mental health providers? And does the government honestly think they're getting good value for money?
Well, Mr. Speaker, this is not my direct area of responsibility, but of course mental health does present challenges for accident and emergency and hospitals more generally. We are investing an extra £2.3 billion every year extra on mental health. We have 16% more staff. We have an additional bursary, Mr. Speaker, to attract more people, nurses, into mental health. But we do recognise the challenges, and I know my honourable friend, the member for Lewis, is working hard to address them.
Stephanie Peake.
Thank you. Question number 3, Mr. Speaker. Thank you, Mr. Speaker. Reducing waiting times for diagnostics and treatment is a priority for this.
To the bench opposite, encouraging their Welsh colleagues to be more transparent.
Shadow Minister Feryal Clark.
Thank you, Mr. Speaker. Mr. Speaker, members across the House will have been shocked and appalled by the recent deaths of children from Strep A, and our thoughts are with all those families affected. Cases are on the rise, and as we head into winter, it is vital that parents are able to get their children the care they so desperately need. The shortage of GPs means too many are struggling to see a doctor, and we are now seeing reports of shortages of antibiotics too. So what advice can the Minister give parents if their children are exhibiting symptoms but they can't get a GP appointment, and what assurances can they give on the supply and availability of antibiotics?
So the Honourable Lady does raise an important issue, and I know it is one that is concerning to many families across the country, and it's therefore helpful to be able to just reassure the House in terms of our response on that. And firstly, whilst GPs are important in this, so are directors of public health, and they are leading the response in areas including the liaison with schools. We are seeing an earlier peak than usual in terms of cases, these cases, and we believe this is due to lower exposure during the pandemic, which has then meant to lower immunity. There is no new strain, and that I think is one of the key points in terms of reassurance. But the UK Health Security Agency has declared a national standard, and that enables them to better coordinate our response, including across schools.
And then Colburn.